So let's talk a little bit about shared decision making. You'll see from the resources that AHRQ has some very, very nice materials about this. It's the kind of thing you use once you've got people starting on this pathway, as we've just seen. Keeping in mind that the pathway always includes, well, I'm not going to do anything at all. You want to help people explore what's the cause of the problem. And you want them to tell you what they think it is before you do. Sometimes you'll find out that people have some mystical view or that they have it nailed, they know what's causing it, but you didn't. The point is, whatever that belief is, you need to be able to deal with it. And knowing about it before you offer your own opinion is always valuable, especially if you can tie your suggestions to the patient's existing beliefs. And testing and treatment options also need to be discussed with the patients before you offer the options. What do you think will help you overcome this problem? This enables you to connect to the patient's personal medicine. That's what we all carry around inside of us about how we deal with problems. And we always go there first. So you might as well know what's in the drawer that has all their personal medicines in it. And again, if you can see some things in the drawer there that would in fact be helpful, you can connect to them and you can empower the patient while adding on some other suggestions. And finally, consequences becomes very important. And remember, side effects are not just headaches and vomiting and diarrhea and rashes. The consequences have to do with our relationships, our occupation, with family responsibilities, self-esteem, and finances. There's a nice letter to the editor in JAMA yesterday that talks some more about the social determinants of health that are so much connected to these consequences. A lot of people like to use a decisional balance approach. Once people say, well, I'm thinking about doing it, but I'm not sure, which is what ambivalence is, then it may be helpful for certain people to begin to look at the benefits of change. Some people like to also look at the disadvantages of change. You'll have to find which of those techniques works best for you. But keeping in mind that that's the way you make decisions very often as well, that you're going to look at the pros and cons, or maybe in retrospect you should have. So while a decisional balance isn't the only way we make decisions, it can influence those decisions. It will also help you as a provider of care to understand better what the values of your patient are, so that you can connect to them after you hear about them and make your case for the decision that might help them reach their own aspirations more quickly. Next slide. So shared decision-making presumes that a person has recognized the pressure to change. That is to say, somebody who is in touch with their ambivalence. Uncertainty about the right decision can be worsened when the person has an incomplete understanding about the causes. That's why it's so important to get their idea about the causes and to help them work those through so that they can see how the options for treatment connect to the causes. Similarly, the nature of change required to deal with the problem may be unclear. You can tell people you really ought to get more exercise, but what does that mean? And finally, the most difficult parts of these changes may have to do with the consequences of change. That's all well and good, but you don't understand. If I do that at work, they're going to know that I have diabetes and I could get fired. Well, that's something you got to deal with. So shared decision means taking these items into account each time you talk with people about the changes they are considering for the problems they have identified. Next slide. And again, the HRQ site has a very nice presentation about moving through the SHARE approach, seeking, helping, assessing, reaching, and evaluating.